Okay, let's move on, and we're going to touch briefly on a few more things. As far as sex education goes, two rules govern answering sensitive questions about topics such as sex. The first, you need to find out what the children know and what they think. You need to investigate the theories the children have produced. Um, as parents, you need to give correct information and help the child understand if their explanation is inaccurate. As healthcare provider, you need to educate parents on the importance of explaining the nature of sexual education to their children. The second rule for giving information is to be honest. So it's true no matter which population you're talking to. It's true that a preschooler will forget or misunderstand some of the information, but about the time you don't tell the truth is when that child is going to restate what you said, and then other children will learn inaccurate information. So we want to continue to be honest and reinforce correct information. It's important to maintain a positive approach. And with a positive approach, it's not condoning or condemning what the children or the pediatric population thinks, but it allows for the child to express their questions and engage in conversation. It's important to not over answer questions. Remember, you need to base your answers on the developmental level of the pediatric client. It's important to remember that sex play is part of normal curiosity. Um, During middle childhood, it's a very good time for these children to have a formal sex education class. We want to provide them information so that they are able to effectively communicate with their parents, but also so that they have the correct information when they are considering exploring the idea of sexual activity. It's important that you remember that sex is a normal part of growth and development. We want to answer questions honestly, matter of factly. And then always remember that you have to answer and be appropriate as far as the child's level of understanding is going to go. With adolescence, that's going to be a very critical time in the development of sexuality. There's lots of hormone changes going on, and all of those hormonal, physical, cognitive, social, all of those things are going to occur during adolescence and have an impact on the sexual development. The process of sexual identity development usually involves forming close relationship with same-sex peers, and then they will oftentimes experiment sexually just to satisfy the curiosity. Reasons that kids explore sexualness is for, out of curiosity, because it's pleasurable for a conquest. All my friends are doing it, so I'm going to do it. And the same thing would go with conforming to peer pressure. The risk of health damaging behaviors is really what we need to focus on. We need to provide education as far as sexually transmitted diseases and transferring those. Homosexual and bisexual youths really aren't always accepted, and so we see increased incidence of suicide or suicidal ideations. So we really want to provide education to this at-risk population. Education and guidance, if you think about it and you think about what's on television and in magazines, on the internet, media definitely influences how the pediatric population becomes aware of sexual education. So really the adolescents perceive nurses, really especially school nurses, as important figures who are willing to discuss sex education and be open and honest with them. It's a really good time for us to discuss the topic adequately. So we need to have an understanding of the physiologic aspects of sexuality and the knowledge of cultural and societal values. And we also need to be aware of our own attitudes, feelings, beliefs, biases, because we don't want to put those off on another, or onto a student or a patient or someone that we're providing care for. When we are providing education, it needs to be consistent with normal body functions. It needs to be presented in a straightforward manner using correct terminology, especially when we're dealing with the adolescent era. And it is important with all the increased incidence of STIs, especially HIV, that the topic of safe sex is brought up. We do, it's important to discuss abstinence. It's important to discuss the use of condoms, birth controls, but then just be consistent in your teaching and don't push any of your own beliefs off onto this population. School health, it is the responsibility of parents to take care of their kids, but we do see public schools and health departments in the United States contributing to the improvement of child health. We want to ensure that we have a healthy school environment, that we have health education. We want to provide community services when applicable, and there are several public fundings available to increase knowledge of the healthy and health habits of our adolescent and school age population. The next thing I would ask you to do is make sure that you are cognizant of optimal health care across the pediatric lifespan. And so make sure that you are looking at dietary requirements for each age group. And this one is just talking about infancy, but you do need to be aware that across the board that you will be asked questions about optimal health during infancy, toddler, preschool, school age, and then adolescence. Along that line is dental health, and good dental health begins with maternal dental health. And so if our pregnant moms have good dental hygiene, then that will be passed on to their child. Things for education, we need to avoid propping bottles. We don't want any fruit juices, and we don't given in the bottle to kids and then having them being put to bed with bottles. There's really no clear guidelines when toothbrushing should begin, but it is recommended by the American Academy of Pediatric Dentistry that infants have an oral health examination by about 6 months, and then they should be seeing a dentist by the time they're a year old. With our toddlers, it's important for regular dental examinations, and I just pulled this slide up so that you can see this bottom picture is a child with profound dental caries. And so really the importance of good tooth care, brushing their teeth, flossing, seeing the dentist, using fluoride if they do not have the fluoridated water is all going to be really important when taking care of the kids. So dental health is going to be important. So as you're doing your reading and you're looking across the lifespan of the adolescents, all of these things are going to be important when we're considering optimal health care. So immunizations, and we will spend some time in class discussing immunizations and looking at those charts, because you do need to be aware of what immunizations are needed when. Nutrition, nutrition guidelines, really we're using the MyPlate for good nutritional guidelines. So that would involve eating habits and behaviors, sleep and rest across the spectrum. Kids need rest, they need sleep. When we sleep, that is when they heal, that's when they grow. So promoting good sleep and good rest, as well as exercise, because we don't want our kids to turn into this couch potato consuming lots of high calorie, high fat foods that really have no nutritional value. So we want to make sure that we are promoting that with dental care. Oftentimes adolescents lack that because of the cost and lack of insurance, things like that. So it's important to ensure that education to parents that they are still having their children see the dentist. Personal care, that goes across the board without saying. Vision and hearing screening should be done at least yearly. Oftentimes they're done at the school level. Posture, we're going to be looking at our kids for scoliosis. We are seeing an increased incidence of body art, tanning. It's important for these kids to use sunscreen to prevent skin cancer. And you see, especially this time of year, or any time of year like around prom or when it's starting to be summer, tanning is a practice that has serious long-term risks. And so the adolescent that tans should be educated on the detrimental effects of sunlight on the skin. So we want to provide education on the use of sunscreens, to wear sun protective factor SPF of at least 15. And then try to use the broad spectrum sunscreens that will prevent or protect against both ultraviolet A and B rays. And stress reduction, there is some information in your book in each chapter about stress reduction in the pediatric population. I talked about the importance of sleep and rest, and we also needed to think about how important exercise and activity is. We want our children to get exercise, be active. We are seeing that increased incidence of obesity in the childhood population. Some controversy regarding early participation in competitive sports. When you think about children, they really, nobody wants to be the loser. And so the height of competitiveness should be comparable to the developmental level that the children are in, because they will generally acquire the skills necessary for the sports and activities and will soon learn to kind of like the competition and will gain that competitive edge over time. So to change our attention to immunizations, there is a schedule for immunizations and recommendations for routine immunization. The internet provides a variety of information suggesting that parents should avoid childhood vaccines, but that information is kind of consistent with vaccine myths, and those myths are based on erroneous information. So it is our nursing responsibility to provide parents with accurate information regarding childhood illnesses and available vaccines, and then the parents will take the information and decide which vaccines they would like for their child. We should address the concerns that parents come with non-judgmental attitudes, and then be supportive of the parents' decision if they decide not to vaccinate their children. When you look at the schedule for immunizations, if you take a look at figure 31.6 on page 981 of your Perry Maternal Child Health Nursing book, you will see the schedule for the routine immunizations. Recommendations are on page 982. When you think about immunizations, you also have to consider reactions. The reactions are typically just local tenderness, maybe some erythema and swelling at the injection site. You might see a low-grade fever or maybe some behavioral changes. Maybe the child stops eating as well, or they have longer periods of crying, those types of things. Children will react to most likely the preservative in the vaccine rather than the actual vaccine component. So when you think about like the Hep B vaccine, it's prepared from yeast cultures. So a child that has hypersensitivity to yeast would be one that might have some reactions to that. With the contraindications and precautions, we need to caution patients who have immunosuppressed children, children that are taking steroids, that maybe have autoimmune disorders. They are going to be the ones that we want to caution against the use. And then administration is also discussed in your book, and how immunizations should be administered. Current recommendations, you can go to the CDC or the AAP.org and look at the current recommendations beyond what is listed in your book.